It seems that people get back to their practice and after the training and they say, well, okay, what is EMDR? How do I explain it? And so simply, it is an evidence-based practice done with licensed mental health professionals who are specifically trained to treat those adults and children who suffer with current or past mental or emotional trauma. EMDR is based on the adaptive information processing model, which simply means our bodies are made to heal, and our minds are made to heal as well, and our brains can heal from those emotional traumas that we experience. So just like a broken arm, when it's set properly, will heal, and little boys can play baseball again, our brains can heal in the same manner with a little help from some EMDR professionals. Do you know that memories can be changed? Of course, it doesn't mean that it changed what happens, but it certainly does change our perception of what happened and the belief we have about ourselves. Because when we're little children, we have thoughts and feelings and body sensations and different kinds of behaviors. But as we grow into adults, we get age and we get some wisdom and experience, and we're not the same anymore. We're adults. So our behavior changes, our thoughts change, our body sensations change. But a lot of times, our emotions just stay stuck. If we've had traumatic experiences as children, we may have developed erroneous beliefs about ourselves, like we're not worthy, or we're powerless or helpless, not good enough. So EMDR therapy can help to unfreeze those negative emotions and bring them up to where we are today, because we do many things today that we couldn't do when we were children. So we're really different people, but sometimes we are triggered and go right back to thinking we're helpless all over again. So EMDR is a way to change our perception of ourselves and to update those frozen emotions. It's different from CBT. It is all about beliefs that we develop about ourselves, but CBT does not immediately recognize the emotional pain that people come into the office with. So those thoughts, feelings, and body sensations, although they change, they come in, and with CBT or cognitive behavior therapy, we simply talk about erroneous beliefs or irrational beliefs that people have developed, not about themselves so much, but just generalized, like black and white thinking or creative fortune telling or some other generalized belief. EMDR takes that a step further. The first thing we recognize is the emotional pain that person has gone through, and then we get to a very personal belief that they may have developed about themselves. So although both of these theories are useful and both of them are about beliefs, I think EMDR gets to the heart of the problem much more quickly. EMDR therapists use bilateral stimulation and dual attention stimulation to update those frozen emotions. So this is completed with eye movement, and we simply move our hands back and forth this way, left to right, to activate both sides of the brain so that those emotions can be updated to where we are today. So, and we'll talk a little bit more about the brain a little bit later and how that is activated. But the practice involves using bilateral stimulation to join the emotional part of the mind, or the part that we are actually born with, those emotional sensations, to the intellectual or developmental side of the brain, which is developed over time as we grow older. So the emotional mind is centered in the amygdala, which is toward the back of the brain, and the intellectual is located in the frontal lobe, which is here. So we have this part of our brain joining this part of our brain so that we have a full circuit. EMDR uses bilateral stimulation as a way to join both parts of the brain so that those emotions can be updated and those beliefs can become much more adaptive. So EMDR is an evidence-based practice based on the adaptive information processing model used by licensed mental health therapists using bilateral stimulation to decrease the negative impact of traumatic experience. I simplify things a lot of times just by saying EMDR in a nutshell is just this. Someone comes in with a problem and I want to know what is the negative belief about themselves that is holding them back from reaching their potential, making better relationships, and living life in a way that is most effective for them. So when I identify that belief, it may be I'm alone, I'm not safe, or I'm not good enough. And using bilateral stimulation does a couple of things. Research has proved that it reduces our emotionality about an event, and it also decreases the image of that event so that it is not so overwhelming and overpowering for us. So EMDR therapy actually is needed because the original event has been coded in one way, and we want to bring that memory back to the surface so that it can be changed to the more logical side of the brain that has been denied a voice because of the emotional sensations around that. And that is what EMDR is.